All right. So yeah, welcome everybody to the More Profit Roundtable. This is the mini version. I do the full version once a month. We do this one every Wednesday afternoon at this same hour, 4:30 Eastern, 1:30 Pacific time. And again, my name is Breck Rice. I'll be your host. And I'm excited to be here and share with you some very important information. So, for more than 2 decades, I've been helping community pharmacies with being more profitable, and it's been a hard progress or situation for community pharmacies because their revenue just keeps going down and down and down, and what you're getting paid from the PBMs. So profit margins have gone from 36% down to like 3 to 5%. And so I want to do anything and everything I could to help the industry. And so that's why we do the More Profit Roundtable. I do host the PBM Reform podcast on the Pharmacy Podcast Network. And we talk about reform. It's a slow process, but you can see, and I'm preaching to the choir here for community pharmacies, you can see that PBMs and insurance has aligned together to put independents out of business. And so we are going to provide some solutions that will bypass the PBMs and bring pure profit to your community pharmacy. So really excited to share with a three-step process. George is going to talk to you about remote therapeutic monitoring, or an RTM program. So for about two years, I've been preaching to community pharmacies, you've got to get involved in more clinical services, and you need to get into medical billing. But there are some costs to getting into medical billing. And so that's why we wanted to see how we could offset some of those costs for getting credentialed. And it's not as much as it used to be. Some of those programs were, thousands and thousands of dollars to get set up. But that's phase two. We'll touch on what the Independent Pharmacy Provider Network does for you. And then phase three is the full brick and mortar wellness center called BRIM. If you have the space for it, it takes a footprint of about a 10 by 12 space. You'll need a hand washing station and all the equipment and everything that goes into that. You can do, one and two, of course, but you can't do three without two. That's very important. The reason why we're starting with the remote therapeutic monitoring is there's no startup costs for your pharmacy to get going, and it will generate the profit needed in order to do step two and step three. So, George, tell us all about remote therapeutic monitoring.
Good. Well, thank you, everybody. My name is George Veronis. I reside in Lancaster, Pennsylvania, and I'm part of Seniors Home Services, one of their national directors. And this is a pretty phenomenal program. We were showing this originally to physicians only. And then when we met Breck and he let us know about the pharmacists and how they could administer this program and get administration fee, he felt it'd be more important to offer it there first and let them make some pure profit. So again, I know we say revenue a lot of times, but this is pure profit. So the first thing you're going to see is it's a great program for your senior patients. It improves their memory, it improves their balance, cognitive issues, stress, decision making, and better quality of life. And you'll see as we go through this, for every patient that comes on as a senior, you'll get an administration fee of $25. So our model is based on at least 100 seniors going into this with our marketing, which we'll cover in a minute. Turnkey system, no access to more people, and no capital investment. That's the key. No capital investment. Over the last 60 days, we probably showed this to about 200 pharmacies. I think 190 have decided to move forward and on board. And when they see what this is all about, the neat thing is what you're going to see is covered by Medicare Plan B and all the Advantage plans for the patient. And again, then we pay you. You don't have to do the insurance. We have our own MPI number that we run this through, and you actually administer it. And again, you get paid. So the first thing I want to do is just run a little 2-minute video, kind of give you an overview of the program for pharmacies, and I'll talk a little bit more about the therapeutic RTM.
It's no secret that pharmacies are under financial stress today and need to find new sources of revenue within their existing businesses. Seniors Home Services is happy to introduce you to our Remote Care Today program that can provide tremendous benefits to your customers and new revenue for your pharmacy. Our remote care service is clinically proven, done over tablet or smartphone, and a Medicare reimbursable program that can help prevent, treat, and often reverse chronic illness, musculoskeletal disorders, memory loss, cognitive regression, and loss of balance, thereby slowing decline while helping prevent falls and loss of independence. Our remote care services are backed by years of success in improving patients' quality of life, helping them remain independent for as long as possible. You can make these services available to your patients as we provide a turnkey solution, including patient engagement, enrollment, support, and Medicare billing under our Medicare NPI. Our patient engagement process is easy and fun with our complimentary Turn Your Selfie into a Healthy app and does not require any additional work for you or your staff. This biometric facial scanning app, which we personalize to your pharmacy, uses smartphone facial scans to read blood pressure, heart rate, oxygen levels, and risk factors with incredible accuracy, engaging patients in their own health by knowing their numbers anytime, anywhere. We also provide posters and bag stuffers with QR codes. As people use the app and receive results, they naturally engage with our support team and learn all about how our services can improve their quality of life. Information on your patient's monthly progress will be available in our secure portal. And if you choose to review their assessments each month, you can earn administrative services fees for the time you spend, all while helping your patients live better and longer.
So, Brett, jump in here and just talk a little bit about the 3 buckets for remote care and which ones pertain to the pharmacist the best.
Yeah, so all of our pharmacists know about these, these services, the chronic care management, the remote patient monitoring, and then the remote therapeutic monitoring. No one vendor, though, can do all 3 for the patient. Medicare won't cover that. And so one of the benefits of working with George's company is that they have multiple vendors so that they can serve the patient in all 3 of these categories, and the pharmacy can get an administrative fee for all 3 of those services. Today, we're going to spend the majority of the time really focusing on the RTM program for you, but just know that those other 2 buckets are available for you to start with patient engagements.
Great. So the remote therapeutic monitoring is the key. And I'm going to show you a program we're going to be using here in this, but let me give you a little video so you get a better feel for remote therapeutic monitoring.
Remote therapeutic monitoring, RTM, is a clinically proven and Medicare reimbursable program that not only helps recovery from accidents, but can be directed to help prevent and often reverse memory loss, cognitive regression, and loss of balance, thereby slowing decline and helping prevent falls, as well as helping with stress, anxiety, working memory, concentration, decision-making, and emotional control. In addition to the physical improvements patients can see, these programs can improve plasticity, which will improve patients' quality of life, helping them to remain independent for as long as possible. We are pleased to make RTM available to your patients and make it so easy as we provide a turnkey solution, including patient support and Medicare billing under our Medicare NPI. Introducing RTM to your patients is easy as we do the entire introduction and education for them. We'll send them a landing page, which can include a short video message from you, as well as educational videos, and then give them the opportunity to enroll right there. We'll also reach out by phone to assist with the enrollment process. When they enroll, our coaches personally call by phone to welcome them and send a welcome email with logins to their personal customized programs. Their personal coaches are available by phone as needed to help them along the way. As with all our programs, we take care of all patient support, coaching, encouragement, and all billing. Remote therapeutic monitoring can have a major positive impact on your patients without creating any additional work for you or your staff. Just click the Get Started button on this page to begin.
So bottom line, I'll come back to this in a minute. Bottom line, it's a program that's going to help age-related situations like working memory, recall, response time, balance falls. It could help detect and prevent, dementia, early discovery of it, cognitive enhancement. You can read all that, stress management, engagement, and challenging the brain. And these are exercises that the senior will perform for about 8 to 10 minutes a day. And as long as they do it for half of the month, basically 16 of the 30 days of the month, then Medicare covers it and you get the administration fee. And we were using a program that just was covered by Medicare Plan B, but as we went out to the pharmacists, we realized that about 60% of their database of seniors had the Advantage plans. So we revamped and we have a new program that's been around for several years. You'll see a little bit about it. And it's something that we're going to put into our RTM platform in the next week or two. And then it'll be available to all your patients and enriches seniors' lives by promoting a healthy brain, body, and spirit. And I'll just show you a little 1 minute on this so you can understand it. And this program has been around, like different big insurance companies that use it into their wellness, like YMCA does different classes for this. So Brain Saver has been around, but we've been able to put it into our RTM's platform so Medicare covers it. So I'll play you just a minute on it.
Brain Savers is a pioneering evidence-based lifestyle program designed and developed to promote healthy brain aging and reduce the risk of what is currently the fifth leading cause of death, and that's Alzheimer's disease. I'm Dr. Paul Bentheim. I'm a neurologist, and I led the development of the Brain Plus Body Total Lifestyle program.
I'm Dr. Gina Touch Mercer. I'm a geropsychologist.
My name is Angie Moore. I'm Programs Manager for Brain Savers.
I make up several of the brain workouts and many of the lessons on cognitive fitness, socialization, and stress management.
My focus is developing the physical fitness aspects of the class, as well as the segments of the class that have cognitive and physical exercises combined.
This curriculum was designed and developed to enable aging Americans to live an enriched lifestyle in place while reducing the risk of Alzheimer's disease.
You can't function well unless you're feeling well. And when you're feeling poorly, it will affect your brain function. We use the science of positive psychology to construct our lessons and our activities to help people function better.
The program we developed is evidence-based. This means that we use published research studies to develop everyday engaging brain and body workouts.
So what we do is make activities that really are building new connections and new nerve cells or brain cells so that older people can function more effectively, they can remember better, and they can have a better quality of life because their brain is functioning better. Being physically.
So let me get back to my PowerPoint. There you go. So the bottom line is that, that's a whole program. There's over 100 to 200 individual programs that are 8 to 10 minutes. So it keeps people excited to come on every day. If they ever miss 2 days in a row, we email them, text them, or call them to remind them to get back on the program. People stay on for months and months, some for years, because everybody at that age group obviously wants to take care of their cognitive issues and their balance and so forth. So the neat thing is you don't have to be involved at all. I'm going to show you the marketing in a second as a provider. You simply have to do a 1-minute exercise a month with each patient, and I'll show you how simple that is.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
So basically, you figure if you have 100 patients on it, it might take you 2 to 3 hours total, and you could have a staff member that you oversee doing it. And if you're making $2,500, that's about $1,000 to $1,200 an hour to implement this and work it. Plus, at the end of the day, you're giving a great service to your patients. One pharmacist that has about 100 locations made an interesting comment to us last week. She goes, "Wow, this is so nice. We don't have to put up any money. We don't have to invest in anything. It's probably the best thing that's going to ever help our patients. And at the same time, we get a nice fee just for administrating it and getting it out there." And then the next question, of course, was, well, we're so busy, we don't have a lot of time to market this. Tell me the steps there. So you heard about the engagement tool called Selfie Healthy, and I'm going to show you one more video. It's a little bit more detail, but we're going to put this on your counters. We're going to put in bag stuffers, or you're going to do that. We're going to send them to you. But the big thing is you sign a BAA and you have a HIPAA compliant form. If you send us your database and we download it into our system, then we'll have someone actually send this out to every senior with a follow-up text and a follow-up phone call. And obviously progresses you very quickly to get a lot of seniors on this program. So we have that whole marketing thing. And I just want to hear one more minute on how this works to get you really comfortable with this engagement tool.
In today's healthcare environment, one of the biggest challenges for medical providers is engaging patients in proactive care. It's hard to convince someone they need help when they don't even recognize the signs. But what if there was a way to make the need clear without you having to be the one to do it? Meet a revolutionary solution for patient engagement: AI-powered facial recognition. We call it Turn Your Selfie into a Healthy. Imagine a technology that helps your patients track their health, identify risks, and stay engaged in programs like our health and wellness coaching to keep on track with their health, all without you having to perform the assessments or having lengthy discussions with the patients. This advanced technology provides an easy-to-use, self-guided experience for your patients. They can complete assessments.
I want to stop there and say one thing. I'm going to go back here. What also makes it very unique, if you work with us and you want to have a lot of success quick, inside this Selfie Healthy, we could do a video with you, the pharmacist, on there, and basically saying, hey, thank you for taking a look at this. We did some research. We found a great program to help you in your senior years with cognitive and balance issues. We highly recommend it. And then take a look at the following video. And if you like it, you can enroll. And then the video on Brain Savers will come on. They'll watch it and they can click right there and roll into the program. Or again, they at the end, when they fill this out, we'll engage in them. So that's a big step that's going to make a big difference.
They can complete assessments from the comfort of their home, gathering valuable data on their own through a 30-second AI facial scan using their smartphone. With 96% accuracy and 98% repeatability, it can analyze metrics like heart rate, blood pressure, oxygen levels, health risks, and others. This is not a substitute for medical care, but it is an accurate way to identify symptoms that just might help your patient recognize the need for lifestyle changes and to make healthier choices with diet and exercise. In addition to the immediate on-screen results, a detailed report is also generated, which we will review with the patient and educate them on how our remote care services can be so helpful. It could also encourage them to become more engaged with our proactive cognitive improvement program, designed to improve both memory and balance. We provide marketing materials like posters and countertop materials. As people use the app and receive results, they eagerly engage with our support team and learn all about how our services can improve their quality of life. This isn't just about making your job easier. It's about empowering your patients and improving outcomes. So, what's next? Speak with your care consultant today to learn how you can enroll in the program and start offering our remote care services to your patients.
So that's the engagement tool that you'll have there, and we'll obviously work with you on it. And then the last thing, it's a very simple process. As we talked to a lot of pharmacists, obviously they're very excited about this. They want to do it. And we simply send out a form to you, an agreement, and then we do an onboarding. So just to wrap it up, Breck, I'll show how simple that is, and then we'll turn it back to you.
Our process is simple. First, we'll create your co-branded Turn Your Selfie into a Healthy app and provide a customized poster and bag stuffers for your pharmacy. Your patients see our materials, scan the QR code, and are taken right to your selfie app without any downloading required. They fill out a simple opt-in form, followed by taking their own selfies. Within seconds after taking their selfies, the patient receives their scan results, along with information about our remote care programs, and are encouraged to contact us to learn more about their results, as well as about our paid-for by Medicare health and wellness programs that also improve balance, memory, and quality of life. To get started, your next steps are easy. First, complete our agreement and sign the BAA, which ensures HIPAA compliance, and then we'll schedule your onboarding meeting. During this meeting, we'll discuss how we engage patients and the materials we can print and provide you that help patients engage with us. We will then educate and onboard your patients using approved text messages, emails, and friendly phone calls, providing the patient the appropriate programs and coaching, all without any cost to you. Your pharmacy then has the option to provide monthly data reviews for each patient, which earns you monthly administrative service fees. Better patient health, new revenue for your pharmacy, improved patient loyalty. Let's get started.
So at the end of the day, Breck, it's interesting. I did an appointment yesterday with someone and had never heard of this program. At the end, they go, "That's it?" And I go, "That's it." And they actually signed up and they're going to move on with it. But anyway, it's a great program. It's all profit, helps your patient. And then obviously, if you do this program, and let's just say over a 3-4 month period, receiving 2,500 to 5,000 a month in pure profit, you have the ability then obviously to go right into the medical billing that Breck will talk about briefly, and it can be completely paid for. And that's even where you make a lot more money in those programs. So Breck, I'll turn it over to you just to wrap it up on the IPPN and the BRIM.
Yep. So phase two, and we'll get to questions at the end here. We just have a couple more minutes to cover information here. But phase two is the independent pharmacy provider network. As I was researching all over the country to find the right solution to help community pharmacies get credentialed and into the payer networks, we saw a lot of well-meaning services out there, services to help pharmacies operate at the top of their license and other credentialing services, and they were really good programs, but some of them fell a little bit short, and many of my pharmacy partners got stuck trying to get credentialed and couldn't get credentialed, and so I mentioned that problem to a healthcare consultant. He said, "You need to meet Ray Vono." And so Ray and I connected about this time last year, and I explained to him what I was trying to accomplish. And he had already developed it, but he was, like Seniors Home Services, was taking it to the doctors for the solutions and not to the community pharmacy. So of course, my recommendation is, hey, we need to bring this to community pharmacies. So it's a complete turnkey program, and you can see here are just some of the CPT codes that are used. But let's go to the next slide, because there's 4 pillars that you absolutely have to have in place. And these are the pillars for success in a medical billing program and clinical services. These are also the same things that can be the failure to your program if not done right. You have to have a turnkey software solution to engage with the patients. You have to have a CPA or a collaborative practice agreement, because even in the states where pharmacies have provider privileges, it's only test and treat privileges. And so to be able to do annual well care visits or to do other screenings, which aren't being done today at the primary care providers because they don't have times, all of those are done through this CPA or collaborative practice agreement. IPPN even helps you recruit the providers to work with you, to partner with you. I was on a call earlier today with a big ACO, the largest ACO in an entire state. They had like 4,500 doctors that is partnering now with IPPN. So wonderful opportunity there for pharmacies that didn't exist before. And then of course all of the things that you can bill through clinical services. And we're talking not just Medicare, although Medicare is a pretty low-hanging fruit to be able to start with those patients. This is for all of your payers. And even before you can get in network, because some payer may say, hey, Cigna, one of our pharmacy partners got a letter from Cigna saying, "Oh, we don't need you in our network. We're closed and we're good in your area." Well, IPPN has gone out and negotiated a contract with a group called Multiplan that is a clearinghouse for all out-of-network bills. So this pharmacy is going to be able to start billing the carriers out of network and get paid for those. And guess what? Cigna's going to invite them in network after they get a few bills from that new clinic. So next slide is the phase 3. Just going to barely highlight this because you can't even go to phase 3 without phase 2. You've got to do IPPN first before even thinking about starting your own brick and mortar clinic. But what's cool and unique about the BRIM program is they'll actually manage it for you. You own it. The pharmacy owns it. They'll manage it. They'll even staff it for you, kind of like Uber for medical staff. So it's a nurse or a medical assistant or a PA that comes in only when you have patients to be seen that day. So that way you don't have to pay for an FTE if you don't have, patients to see. And then the third leg of this stool is a financial vehicle that I'm pretty excited about, because this is another profit center for our community pharmacies. You can actually help or be a cooperative member of the pharmacy fund and help other community pharmacies get set up and get their clinic set up, but then you are earning a really nice return on your investment in the pharmacy fund. So it becomes a whole nother financial vehicle for our community pharmacies. So that's the full presentation. As promised, we'd do it under a half hour. I will stick around. We do have one hand raised. Feel free.
Let me wrap up with one comment
Okay.
right before you go to questions, and then I want to stop the video, and then we'll go to questions. But at the end, I want everybody to understand, though, we are 3 different processes and companies, so it's not like you have to do all of them to do one of them. So we start with Senior Home Services. That's the company we represent, to do the RTM, to get you the profits and to help your patients. Then secondly, you can look at the medical billing. Now you can do medical billing right now if you want. You don't have to do Senior Home Services, right? I mean, you can start right away. If you have the money, you can go do that and start taking advantage of both. And then, like Breck said, if it all comes together and you want to go to another stage, but one doesn't correlate to the other, except for obviously the IPPN with the BRIM. So I wanted to make sure that was clear, but that is our program. I can tell you, talk to the person that invited you on this call. If you have to do a more of a one-on-one, you want to ask more questions, you're welcome to get together with Breck or myself. And also, if you move forward, you simply will get the form and get an onboarding call in the next couple of days, and we can have you up and running within a week. So anyway, thanks for your time.